Unfortunately, most patients who get diagnosed with lung cancer have already stage 2 or stage 3 disease. Stage 2 or stage 3 disease means that the cancer cells have left the tumor in the lung and have actually traveled to the lymph nodes. Lymph nodes are the normal filters of the blood. We all have lymph nodes from our head to our feet. And it's the first place that cancer goes to when it leaves an organ. Whether we're dealing with lung or breast or colon cancer, it's the first place the cancer propagates to, goes to. And if you have cancer cells in the lymph nodes, in the filters of the blood, you can safely assume that there's a few microscopic cancer cells that have gone through that filter into the bloodstream and may have gone elsewhere in the body. In fact, when we take patients to the operating room for stage 2 or stage 3 cancer, the majority of them already have microscopic cancer cells that have gone to the brain or the bones or the liver that we just cannot see on a PET scan or a CAT scan or an MRI. The fact that the cancer is in the lymph nodes, in the filters of the blood, we can assume or predict that a few of these cancer cells are already out there. So surgery is a good way to control the disease locally, to remove the tumor in the lung and in the lymph nodes. However, if we want to achieve a high cure rate, we have to give cancer medication that goes in the bloodstream to go catch those cancer cells, those microscopic cancer cells we can't see on CAT scan that may be elsewhere in the body. And that is systemic therapy. So for stage 2 and stage 3 disease, in addition to surgery, a patient must get systemic therapy. Cancer therapy that goes through your whole system. Chemotherapy, immunotherapy, ADC, radiopharmaceuticals. Sometimes patients who get diagnosed with lung cancer, with stage 2 or stage 3 lung cancer, are rushing to start treatment, want to get it out immediately with surgery, or rushing to start systemic treatment. But in fact, it's actually wiser to wait to get all the information from the tumor, all the data from the tumor, such as molecular testing, genetic fingerprinting of the tumor, looking for protein overexpression, to know exactly what type of tumor it is, and are there specific targets on that tumor that we can use more appropriate, more effective medication. So although yes, it's important to try to start cancer treatments immediately, it is best and wiser and better in the long term to wait a few extra days or a week or 2 more to be able to get all the information from the biopsies, from the molecular testing, get to see a specialist in a major cancer center to start with the right treatment from day 1 and not any treatment yesterday.